Okay, so this is a good stretch for the ankle, for an ankle injury when starting an initial ankle rehabilitation program, okay? So go ahead and straighten your knee out for me, okay? And go ahead and bend it again. And you're gonna go as far as you can until the point of pain, okay? And this is just to help with increasing range of motion of the ankle after a traumatic injury. So you can hold for about 15 to 20 seconds. And then what you're going to do, even though there's a little bit of discomfort, you're going to push it a little bit further now, okay? As far, a little bit more is in the knee, good. Even though it's a little bit of discomfort, you can still go to a little bit further in the range. Good, and straighten it out. So you'll do that for about 30 seconds. And then you can do that 3 times. 3 times at 30-second holds, okay? So that's the first stretch. That's with the slant board. Now, if you don't have a slant board, why don't you go ahead and follow me.
Jessica got?
And so now what you're going to do is you're going to hold on to the rail. Most people have a step at home, on a porch or a number of steps on a second-story home. And so what you're going to do is you're going to put both feet on the step. Yep. And you're going to walk your feet back a little bit, okay, so that your heels are off the step. And what you're going to do now is you're just going to dip your heels down as far as you can go. Okay, both heels. And just hold that stretch for, again, 30 seconds, okay? Now, is that painful there at all? A really good stretch, okay? Now this can be done initially after you start an exercise routine rehabilitative program with your doctor or therapist. This is something that you can do at home as an exercise in order to increase range of motion, as long as it's prescribed. Now from here, what you can do in order to start strengthening it is we'll go ahead and bring your feet off of the step. Go ahead and bring both feet off the step. Good. And you're going to slide your feet over just a little bit to the right. Good. And you're going to use the handrail kind of to help you push your heels up. What you're going to do is calf raises, okay? So you're going to come up off of your heels on the balls of your feet. Okay? And then you're going to come down. You can do 10 of those, all right? So you're going to come down and back up. Now sometimes in the initial rehabilitative program for the ankle, you won't be able to get the involved ankle or the hurt ankle or heel up as high as the other heel, and it might hurt a little bit. You can use the rail. You see the rail there where my patient's hand is to help. You can push your hand against the rail so that it actually helps you have less weight, or you're less weight bearing on the foot. Okay, so an advanced exercise from the calf raises is going back up to the stepping on the step. So both feet on the step. Yep, and bring your heels back off the step again. And you're going to dip your heels again. Yeah, dip your heels again like you did. Good, and now you're going to raise up on the balls of your feet as high as you can go. And then come down. And go up again. And you can repeat this again 10 times. Either 1 set, 2 sets, or 3 sets, depending on what you're prescribed by your doctor. Now we'll go right to the next exercise, okay? And that is a one-legged heel raise, okay? So now you're going to go. Let's do the uninvolved foot, since we are we want to be careful. And we're going to do the uninvolved foot, and you're going to come up as high as you can, and then all the way down. And this is just a one-footed calf raise. Right, so you'll come all the way up as well, and then come back down. Good. Now what we'll do is go ahead and come off of the step with both feet. Okay. And you're going to go ahead and face me now. Now, this is a one-legged balance, okay? Now, this helps with proprioception of the ankle as well. So you're just going to come up on one foot and just stand on one foot. Yep. And if I can get it up close enough, you'll see the ankle muscles and ligaments work a little bit. And go ahead and let go of the rail. And you'll see how the foot likes to pronate and supinate based on the way that the balance is challenging the body and the ankle. Now, you can't see the patient's eyes, but I'm going to ask the patient to close their eyes now, okay? Go ahead and close your eyes. And now as she closes her eyes, you'll see that that foot really wants to work because the eyes are no longer being utilized for balance. So this is another strategy for corrective ankle exercise, a corrective ankle exercise strategy in order to help increasing proprioception and balance and strengthening for the ankle with the eyes open and then with the eyes closed. So go ahead and open your eyes now. And you can see how as she opens her eyes, the ankle doesn't work as much. So eyes open, you can do 3 sets. You can do 30 seconds each set. As the days go by with your at-home exercise program, as the ankle gets stronger, you'll notice that it's not as challenging for the ankle with the eyes open. And then at that point, you can switch and then start doing exercises with the eyes closed, one-legged balance with the eyes closed. And we'll go to one last exercise. We'll come back over here. And here we'll use a Bosu Ball. And the Bosu Ball is another good exercise piece of equipment to utilize for corrective exercise strategy. And this exercise, what we're going to do here is, in fact, we'll pick up we'll actually just use the ball instead. And what you'll do is you'll go ahead and step on the ball. In fact, let's do this. Usually the safest measure, and even for the sake of the video, the safest measure is to always have something to hold on to, so that if you decide that you're going to fall, you can utilize the handrail to help you prevent the fall. So you're going to step up and then step down. And step up and step down. So these are just called regular Bosu Step Ups. You can use a handrail or not, depending on where you're at in your exercise program. And you can repeat this exercise up to 10 to 15 times, depending on what your therapist suggests. And you can, then from there, you can utilize this Bosu Ball for a number of different exercises to challenge the ankle. You can advance the one-legged balance, eyes open, eyes closed. You can do calf raises on the Bosu Ball as well to really increase the challenging aspect of your exercise program in order to improve strengths and decrease weaknesses.